Well, you can't go very far in downtown New Brunswick without seeing expansion. Things are happening downtown with parking decks and with the theater district very soon. And also at Robert Wood Johnson University Hospital, plans announced for an expansion of the emergency department. And joining me right now on the Jersey Central Newsmaker hotline, I want to welcome in our special guest. He is the Chief Medical Officer for Robert Wood Johnson University Hospital. Thrilled to be joined by Dr. Josh Bershad this morning with some details on this very exciting expansion. Doctor, welcome to WCTC. How you doing?
I'm doing great, Bert. Good morning. Thanks for having me.
My pleasure. Thank you so much for taking the time. Why now, Doctor? Why this expansion, and why is this the right time to do this?
Well, as you probably know, Robert Wood Johnson University Hospital is one of the 3 Level 1 trauma centers that takes care of the sickest patients in accidents and all sorts of other injury-related illnesses across the state. And it's time for us to grow the space to provide a more patient-friendly spot for our thousands of patients that arrive in the emergency department every year to get their care.
So part of this is due to volume and the number of patient visits at the ER there downtown, right?
Yes, we see about 95,000 patients every year in the emergency department, and we need to grow the space to provide a more comfortable and effective place to care for them.
How much bigger are we talking about here, Doctor? What can we expect when this is all done?
So it'll be about a 50% increase in space. It's going from 40,000 square feet to about 60,000 square feet. So it's a very significant change in the space and size of the emergency department.
Awesome. Talk about the patient care and the patient experience. So what are some of the enhancements that patients can expect with this expansion?
Well, I think it's important for our patients and for our physicians and for others who utilize our emergency department that there's private treatment spaces. So there'll be approximately 100 new private treatment areas for patients. There'll be a separate pediatric area, which we already have today, but it'll be expanded. And obviously that's focused on the ability to care for the patients, which are the kids in this case, as well as their families. There's a fast-track area, which is an area where patients who are coming in with less severe illnesses and injuries can be taken care of quickly and hopefully get out of the emergency department quickly. Importantly is to have radiology services directly in the emergency department so we can take images, x-rays, CAT scans quickly and get that result back and take care of the patient more quickly. There'll be new entrances, new places for the ambulances to arrive. So it's an overall complete makeover and redo of the current space.
It sounds very thorough, like you said, everything from being able to kind of get patients, get them, a fast track option that gets them in. And boy, just expanding the number of ambulance bays, something like that. It's amazing how far that's going to go with this expansion, which is very exciting. Timetable for all this, Doctor, when can we expect to see this begin?
Well, the first part is obviously we're still open taking care of patients today. So that makes the construction process a little bit more complicated because we want to provide superb care for all of our patients during the construction process. So we started approximately March 1st with the construction in New Brunswick. You probably saw the cranes and traffic cones, and we'll be finished with the first phase of the construction process by mid-year next year, June, July timeframe. Obviously, that means that we have to move around traffic patterns and changes, and we're keeping everyone posted through email, Facebook, Twitter, and all the other different ways that we can notify everyone. Thanks for having us. This helps us tell everybody that the place is still open, and just check the website if you have any concerns about how to get here.
Yeah, I think that's the important thing, whether it's Robert Wood Johnson University Hospital and this news about this expansion here or what's happening with the various parking areas and the theater district very soon. Business continues in New Brunswick. You're still able to get around. There might be a detour or some things happening here and there, but the entire area is still going to be accessible, and I think that's the important thing that we want people to know about the work that's going on at Robert Wood Johnson University Hospital as well. You'll still be able to go there for excellent care as always, but this construction here is not going to impact things greatly. You'll still be able to get through the area. And again, a 50% expansion is pretty significant, and you look at the growth of New Brunswick and central New Jersey, this is just another way that Robert Wood Johnson is meeting this demand, right, Doctor? That's what this is about?
Absolutely right. Best care for our patients, best access, best ability to take care of people in a comfortable setting.
Awesome. All right, Dr. Josh Bershad, Chief Medical Officer, thank you for the information update. Keep us posted on the expansion, all right? And it was great talking to you this morning.
We will. Thanks so much for having me.